Hello everyone, I'm Christine Gikundiro. Today I'm going to teach you about malaria, where I'm going to focus on causative agent of malaria, mode of transmission of malaria, and pathophysiology of malaria. Malaria is a febrile parasitic disease which is caused by a pathogenic action of hematozoa of different species of genus of Plasmodium, and it is transmitted to humans through the bite of a mosquito or vector. And the mosquito which is responsible in transmission of malaria is female Anopheles mosquito. The causative agent of malaria. There are 4 species of genus Plasmodium which are responsible for human malaria. These are Plasmodium falciparum, which is the most prevalent agent of malaria and which kills. There is also Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. The pathophysiology of malaria. Malaria is developed via 2 phases. There is exoerythritic phase and erythritic phase. In exoerythritic phase, it involves the infection of hepatitic system or liver, whereas the erythritic phase it involves the infection of arthritis or red blood cells. The fever in malaria occurs at the end of a erythritic phase. During this phase, the merozoite raises the red blood cells, and this hemolysis is accompanied by the release of hemozoid pigment, which directly goes and disturbs the hypothalamic functioning and causes the occurrence of fever. Means what? It means normally the fever in malaria, it starts to occur when the malaria is in the erythritic phase. Then erythritic phase, it occurs every 48 hours in Plasmodium, falciparum, vivax, and ovale. While in Plasmodium malariae, it occurs within 72 hours. Plasmodium falciparum, vivax, and ovale are responsible for tertiary fever, while Plasmodium malariae is responsible for quaternary fever, which means the fever which occurring at every 4th day or after 3 days. Then the fever is intermittent. The symptoms of malaria are directly or indirectly linked to the erythritic schizogony, while hepatitic schizogony is asymptomatic. As mentioned, fever results from the release of pyrogene, which is hemozoin, during hemolysis. Then the pallor of mucosal membrane or anemia is due to release of red blood cells which are parasitized. The hepatomegaly and splenomegaly occur after a certain period of evolution. This is related to the macrophage hyperactivity, means phagocytosis of residue of red blood cells and congestion of this organ. Severe forms of malaria are primarily due to Plasmodium falciparum, which multiplies in the capillary vascular organ. This mechanism phenomenon causes a slowdown in the local circulatory flow. Then the parasite red blood cells release the stocking by the activated macrophage. The result will be the circulatory anoxia, anemic, cytotoxic effect responsible for the suffering and also the multiple organ failure, especially with cerebral coma and conversion. Plasmodium falciparum has a tropism to capillaries of deep organs, and its multiplication inside the erythrocytes of this organ create the thrombosis, means it create the capillary obstruction and cause the cellular anoxia. Thank you for your kind attention. If you have a question or comment, you are welcome to the comment section, and remember to subscribe, share and like. Thank you very much.